Hello and welcome back to my YouTube channel. I'm Tenzing, your host for your segment today. Teeth is something I want to talk about. It's a very essential part of your body, but we don't take it seriously until we have an emergency. So we have with us Dr. Himani. She is the co-founder of Chiranjivi Center. So she is a dentist and an oral maxillofacial surgeon. Thank you, Dr. Himani, for being on my show.
Thank you, Tenzing.
We're very happy that today we're going to talk about dentistry and oral maxillofacial. Well, she's an oral maxillofacial surgeon. So what exactly is an oral maxillofacial surgeon, Dr. Himani?
So we know that if we have some problems with the heart, we run to a cardiologist. If something in the stomach, we go to a gastroenterologist. If we have a fractured bone, we know we have to go to an orthopedician.
Okay.
Just like that, dentistry also has 8 different kinds of specialists. Maxillofacial surgery is any surgery of the jaw and the face. Anything, if you have a cyst in the jaw, a tumor, or a fracture in the jaw, or you need alignment of your jaw, if you have a very protruding chin, or you have a short gummy smile with a lot of upper teeth showing in the smile. So any kind of surgical treatment that involves the face and the jaws is performed by a maxillofacial surgeon. That can be a thing as simple as a wisdom tooth removal or a simple dental implant, because these are all done by drilling and some kind of surgeries. Or it can be more extreme things like the TM joint, which has problem, a joint arthrocentesis or a joint lavage or a joint replacement also, or other things like jaw alignment, fractures, cysts. So this is what maxillofacial surgery is. Apart from that, in dentistry, we also have other specialists. Just like a pediatric doctor, we have a pediodontist who takes care of the children's teeth. We have a prosthodontist who takes care of the artificial dentures and caps that we put on the patients. We have an orthodontist who aligns the teeth and by braces and aligners and such things. We have a periodontist who takes care of the gums of the patient. So here in this center, we have all specialists, all specialities of dentistry, but individually performed by specialists.
Okay.
So this is what the different specialties in dentistry are.
Okay. So as she was very descriptive, a difference between a dentistry and an oral maxillofacial surgeon. So you cover dentistry as well. So that comes under the dentistry field, right?
Yes. So there are certain procedures which are very basic, like a filling in the tooth or cleaning of the teeth or a cap on the tooth. These are very basic procedures that every dental clinic usually performs. But then the specialist procedures which need a specialist attention, they are performed by the postgraduate specialists in each department, which is all performed.
So you do implants, crowning, all of that as well, right?
Of course, everything is done here.
Okay, so just for my viewers, I just want to give an estimate of an implant, tooth implant. You know, how much would that cost over here as compared to one in the US or anywhere in international countries?
So there are 2 ways of doing implants. Either you buy cheap implants and do your procedures in a very cost-effective way, cost-effective or with no heads and tails, or you can buy exactly the same implant that is bought in the US. I mean, I can give you examples. There are Noble Biocare, there are Ankylos and Strawman and brands which have their origin in the US, and the patients in the US are using those implants very effectively. And you buy the same implants and perform the same surgery by the same specialist here in India. But there's a lot of difference in the cost. So in US, maybe something around 3,000 to 6,000 US dollars for a single implant, start to end, like till the cap. But here in India, it will be somewhere around, say, 120 to 150 US dollars. So there's a huge difference in cost with the same brand of implant and the same kind of specialist performing the procedure. But there's a lot of difference in cost. So we have so many patients coming, flying to us from US or Australia or even Thailand.
That's literally 1/20th of the cost.
That's a lot of difference. That's a lot of difference. So the same cost, they visit India, they get their procedures done, they travel, they show their kids around different places in India, and they fly back. And that's even cheaper sometimes than the cost they have to bear there in their own country.
As I said again, medical tourism at the same time getting your medical treatment done, right?
Exactly.
So that's what is Govinda Lifecare is about. So a few minutes ago we were talking about orthognathic surgery. What exactly is that? Will that be covered under your specialty, or what exactly is that?
Yeah, so like I said, any surgery would be a maxillofacial surgeon's domain. So orthognathic literally means orthos is aligned and gnathos is jaw. So any alignment if there's a malalignment of the jaws, that is corrected by a surgery called orthognathic surgery. Just for example, you may have a patient, somebody may have a smile with a lot of upper teeth showing, gums showing. That's called a gummy smile. So that can be because of the short upper lip, because the upper jaw being a lot out of the facial central line, or the lower jaw being a little behind the central line. So all the surgical corrections that we put cuts into the bone from inside the mouth, align the bones like we want to, put plates just like we treat fractures, and we align the jaws just as per the patient's functional and cosmetic demands. So the function, like some people snore a lot, maybe they don't have a lot of space in their airway. So bringing the lower jaw outside will open up their airways as well. So their breathing will be much better than what they used to breathe before. The cosmetics is much better. Quality of life is much better. So this is what orthognathic surgery is, starting from simple things like chin augmentation to more extensive things like a bimax or a bi-jaw surgery. So all that is orthognathic surgery.
Okay, as you can see in the pictures, it's going to be up there as well when what she's talking about the orthognathic surgery. These are very extensive surgeries, right? Yeah. You will need under general anesthesia.
Most of them are performed under general. They're comfortably done under general anesthesia.
If the patient wants to come for an implant, for example, implant crowning, how long does the patient need to stay in India for, if given an estimate?
So crowns are usually quick procedures. Crowns can be done in as less as 2 hours. If you have a CERAC, which a machine that builds a crown then and there. 2, if they have some time, they can be sent to the lab. There are very good internationally acclaimed labs here in India, which give an international warranty. Like any sort of problem, they can be done, corrected anywhere in the world. So they take some time. They take around 6 to 7 days to be for the measurement to be taken and the final crown to be pasted into the tooth. Implants take from anywhere between 10 days to 3 months. So the patient can always do the surgical phase now, go back, and whenever they are visiting next time, they can get the caps done. So that depends on what kind of bone we have, what kind of procedure needs to be done. It's variable.
Yeah, but so we can always do that online. We have, as I said before in my previous segment, we have patients who do a video consulting. We have that options available. We are very internet driven nowadays. So yeah, exactly. So we basically do a video consultation. She can see the patient online, and then once given an estimate of the time and the time frame and the costing, then we can fly the patient back to India and get all of the expansive procedures done, the X-rays, all of that.
Exactly.
Right?
We can just get a simple CBCT or a simple CT scan done, just where the patient is. On that CT, we do all the planning, all the implant planning that is required is done on the CT scan. Right, the patient is there wherever he is, and the planning can be done here. And from that planning, we can give a time and a cost estimate to the patient. The patient can come down, get the treatment done, and fly back.
Yeah. So that's it. That's it for the dentist segment for today. Thank you, Dr. Himani. It was a very good, interesting video actually. We learned a lot about dentistry. Even I had no idea that we cover all these varieties in your specialty. Procedures in your specialty. All right, please subscribe my YouTube channel and look out for my next video. Thank you so much.